Welcome to Shore Talk. Shore Talk is designed to keep you better informed of what's going on here on Virginia's beautiful Eastern Shore. Now, here's Shore Talk.
We have Dr. Ed Bull and Janet here today, his wife Janet from Bayside Chiropractic. I can't say that.
Say that 10 times.
No, I can't say it once, much less 10 times. All right. And good afternoon. Welcome to Shore Talk. And I'm sure you're going to have something very interesting for us.
Absolutely. We've got a good, we are going to finish our cervical series today. Got some very exciting things that really tie in with posture and the health of the cervical spine. And it's going to be an interesting show. But I wanted to start with, sometimes I like to start the shows with a thank you, but I think my thank you today needs to be directed at my wife. We are very busy at the office. I think we had our busiest day last week. Was it 41 patients in one day?
40-something, yeah.
Yeah, so we've been really busy at the office. And not only is Janet my rehab therapist and does our stretching and performs a lot of our laser treatments, but she's also the office owner, the office manager, our bookkeeper,
Janitor.
She juggles a lot of things at the office and at home, and she's also taken on and helped me with my mission. And one of the reasons that we came back to the shore was to educate people of the Eastern Shore, not only about chiropractic, but about health in general. And just for an example, Eastern Shore, Virginia has second highest cancer rate in the United States, and there's a reason for that, Charlie. So our poor health in general, a lot of it is set up by the pharmaceutical companies. United States has 4% of the world's population. We take 80% of the world's medications, and we rank 79th out of 85 nations, World Health Organization statistics, 79th out of 85 nations as far as how healthy we are. So part of my mission, when we decided to slow things down a little bit, we didn't slow down much.
No, we didn't.
But part of my mission was not only to help people of the Eastern Shore from a chiropractic standpoint, but to educate people on the Eastern Shore about what true health really is. So Janet has kind of been encompassed into my mission, and a lot of that mission involves coming up to the radio show from Cape Charles every other Tuesday and helping with the radio show. So I wanted to really thank my wife for all of her efforts at the office and at home and helping me with my mission, and hopefully our listeners get a lot of good information out of it. So
thank you, honey.
Thank you. No, thank you. So today we're going to tie in, Charlie, the last show we talked about lateral cervical curve. If you're looking at the neck from a side view, we want to see a 60-degree curve, and there's two purposes. God designed a 60-degree curve in our neck from a side view. Primarily, average brain and skull weighs 10 to 12 pounds, as heavy as a bowling ball. So that 60-degree curve acts like a spring and provides shock protection. Second purpose for that curve, it keeps the weight of a bowling ball centered over the body. So we talked about the basics of how you obtain and maintain health of the disc, normal range of motion in the neck, normal curve, normal flexibility, lack of injuries, lack of trauma. All those factors affect health of the disc, affect spinal stenosis, not setting up, disc degeneration, vertebral degeneration. The general health of the cervical spine is greatly affected by motion, and that motion is greatly affected by structure, by posture. So our topics today are going to tie in with that lateral sagittal cervical curve, the spinal model that chiropractors try to obtain with the patients and educate their patients about. And some of these things are not issues that you would associate with chiropractic care, but very effective for treatments, and they respond incredibly well to chiropractic care. And the first one, Janet was kind of internet surfing on the way up here, and it was an announcement on in the sports
Tiger Net.
avenue, Tiger Net.
Clemson.
Yeah, she's a avid Clemson fan, and it really ties in today with our topic. Guy's name was
Dwight Clark.
Dwight Clark. He was I guess he was a wide receiver for Clemson University, and then he played 8 years for the 49ers, San Francisco 49ers. He passed away at the age of 61, I guess, here in the past few days. Age of 61 after his battle with Lou Gehrig's disease. Now, folks, Lou Gehrig's disease, and this ties in with the study I've mentioned here briefly. It's called The Role of the Craniocervical Junction in Craniospinal Hydrodynamics and Neurodegenerative Conditions. Now, ALS, everybody's heard of ALS or Lou Gehrig's disease. That is a neurodegenerative condition, and it is greatly affected by posture and that lack of lateral sagittal cervical curve. So the study that I've referenced here lately ties in ALS, it ties in MS, it ties in migraines, it ties in Alzheimer's, it ties in Parkinson's, very significant degenerative conditions, and there's no doubt in my mind that his ALS was caused by trauma that was set up in his college career, repetitive trauma that was set up in his professional football career, and that trauma affected his lateral sagittal cervical curve. That trauma eventually led to his obtaining Lou Gehrig's disease. So the bad part about ALS is your brainstem is affected, so your normal autonomic condition systems that we don't have to think about, these people usually die because they can't breathe anymore. They lose the ability to breathe. They're on a feeding tube. All of the automatic functions that God was so incredible in designing our nervous system to handle, they lose the ability. So most of these people suffocate. That's how they die. So there's no doubt in my mind that it ties in with this. And along the same lines, I had a patient that came in this morning, and he usually comes in and sees us only when he's got a crisis, just 2 or 3 times a year, and he has a job that involves sitting in front of a computer, and his posture is horrible. And every time he comes in, I tell him, your issues with your neck, your issues with your back are caused by your poor posture, caused by that lateral sagittal cervical curve. And you need to you need to be proactive, not reactive. Don't only come and see me when you got a crisis. Well, he said, well, I was cutting wood, splitting wood about 3 weeks ago, and my clavicle's really been hurting. And I said, directly related to your posture, your loss of curve, sitting in front of a computer all day, and you subluxated or you misaligned where the clavicle attaches to the sternum, and that is greatly affected by that head forward posture. So I explained it to him, and I said, if you don't make some lifestyle changes, some structural changes, he will end up, Charlie, I know you've seen elderly men that have a big hump on their back,
Right.
and they're almost falling forward. That all started 40 years before that spine collapsed. And what happens, they lose the lateral cervical curve in the neck, the head starts to project forward. When they get in their 60s and 70s, osteoporosis sets in. Those vertebrae actually collapse, and they're stuck in that posture, and these men suffer. My grandfather, and this is part of what subconsciously led me to chiropractic, but my grandfather grew up on off of Scarborough's Neck Road. He grew up on Craddock Creek, and my great-grandfather had about 3,000 acres. They owned most of Scarborough's Neck Road, and they farmed all that land. Well, my grandfather had a tractor roll over on him, I think it was in the 1920s or 1930s, when he was farming, and he had some compression fractures, and he had that, what they call a thoracic hyperkyphosis. He had that hump from a young age, and the man suffered. The man hurt all the time. He had a lot of heart issues. They think he had 13 heart attacks before he died. He had venous disease where he had open sores on his legs, and I never, I know the man was in tremendous pain. I never, ever heard him say one cross word to anybody. I never, ever heard him complain about pain. But he told my grandmother and some of my family members that the only relief that he ever had with his back was he saw Dr. Ferguson, which used to had a little practice there in his house. He was a retired chiropractor that actually got his license from Cleveland Chiropractic College, I believe in 1924.
Wow.
If I remember right. Yeah. So he worked on my grandfather, I guess, in the early and mid 1970s after he had retired. But I think he lived down around Cashville. I actually got some of his chiropractic equipment from his wife after he passed away.
Yeah, I know where he lived.
Oh, yeah. Yeah, absolutely. So, that was one of the, I guess, the directions that, besides my own personal experience with chiropractic and how it helped me. So, having those postural issues and having them for a long time causes some detrimental health issues later in life. So that patient with the sternum issue this morning certainly hit home. That football player that passed away, Dwight. Also, another interesting tidbit, I had a patient that started over the past 2 weeks, something that people don't associate with issues with the neck, loss of lateral cervical curve, posture issues, but it definitely ties in. And some of the dentists that I've worked with in the past were smart enough to understand the tie-in between posture and TMJ. Now, TM had a patient that started up a couple weeks ago. She called and said, I've got some TMJ issues going on. I've got some hand numbness. I've worked in the past with a chiropractor from across the bay, and I heard that you did some other things besides neck and back pain. I said, sure, come on in. So we've been working on her TMJ. I think we've worked on her, 3 or 4 times so far, Janet?
Yeah.
And definite improvement. So TMJ, temporomandibular joint, the muscles that originate on the clavicle, come up and attach at the jaw. That's the sternocleidomastoid muscle. And the scalene muscle, but they also attach at the base of the skull. It's the attachment at the jaw associated with that head forward posture that starts pulling down on that jaw on a regular basis. And same thing, had a job in front of a computer, head forward, leaning forward all day. So significant improvement in her TMJ. So something it's...
What can you do if that's your job?
Oh, absolutely.
And what can you do to,
ergonomics. And that'll, Charlie, that perfect, apropos question. What I tell my patients is, number one, put your computer so it sits directly in front of you. You don't want to have to turn your head to look at your computer, and you want it elevated. So either elevate your monitor, get your keyboard at a comfortable position, ideally lower your seat so that you have to look up. So you want your keyboard low, you want your monitor high, and you want your monitor directly in front of you. And just simple things, I say take a break 2 or 3 times an hour for about 30 seconds, lean back in your chair, rotate your head back and try to look at the wall behind you and hold that pose for 30 seconds. And while you do that, pull both shoulders back, put your arms down by your side and your palms facing forward, and try to stretch your shoulders back also. So some ergonomic things like that. Also, and I catch patients in our waiting room all the time, and it drives the girls nuts. They would like to keep me in the back so that I don't interrupt the office flow. But I go up there and I'll see patients on their cell phone, or I'll see them reading a magazine, and they've got a cell phone or their magazine in their lap, and their head is pointing straight down. That is a definite no-no. So
No, we'll tell them that.
Yeah.
If we see that, I'm like, Dr. Bull's going to come get on you. You better hold that phone up.
Absolutely.
Better hold that, they're sitting in the waiting room with their phone up.
Right.
So I think it's starting to catch on
Absolutely.
with people.
Yeah. So just becoming more aware of your posture and more aware of little lifestyle things that you do that aggravate your posture. So kids with cell phones now, you're really setting up them for lifelong posture issues and lifelong health problems. So parents out there, if you've got kids that spend a lot of time on the cell phone, have them hold that cell phone up in front of their face instead of the head down. If you think about the amount of hours and the amount of time per day that they're in that posture, and look at posture in school, sitting at a desk looking down. So a lot of little becoming more aware, little lifestyle changes, little ergonomic changes can make a huge difference.
One of our patients today, she was leaving to drive to Washington, and then she had to drive on somewhere else, and she has the neck posture issues. So, I was just telling her one thing that I did is I drive with my hands under instead of, over. You're tightening up all your chest muscles in the front of your neck. Drive with your hands underneath, palm up. That tends to help me pull my shoulders back. And, you're in traffic and stuff. You may not always be able to do that, but, what happens, we're hands forward, palms down, and we start to grip the steering wheel.
Absolutely. And lean forward. You see that when we're driving.
All the time.
See people leaning right up into the steering wheel. And that, Charlie, this is interesting, and I didn't realize it until Jacob started preparing for getting his driver's license, but we were taught to sit in front of the steering wheel and put your hands at 3 o'clock and 6 o'clock. Yeah. And that has changed now. They tell them to put their hands at the bottom of the steering wheel because I think it's because of the airbags. If the airbags deploy and your hands are on top of the steering wheel, then it can cause some injuries. It can, actually blow your hands off the steering wheel. Then you lose control. So little ergonomic changes like that. And most people don't realize a lot of the safety measures that are engineered into vehicles nowadays save lives, but they cause more injuries. A lot of people get whiplash, not only from the impact of the car accident, but from the airbag. So we'll go into some of the dynamics of that in a few of our future shows. We're going to be talking about car accidents and what actually happens with an accident from an engineering and physics standpoint, and some of the insurance hurdles along with that. And that's had a little frustration lately. I've been, as some of you know, I help some of our retired vets with some of their VA claims, and some of the things that, Charlie, you hear on the news about the treatment of our vets by the VA. I don't know, it's just sickening. It aggravates me. Prime example, I got a kid that's in his mid to late 20s, was in the Army, had recurring issues with hamstring pulls, and it started in basic training, and also had some instances with his low back as far as pain, and the military docs weren't, and physical therapists weren't smart enough to figure out that, hey, maybe the hamstring issue is really caused by the low back issue. So he's got a claim with the VA, and they denied his benefits, and I started going through his record, and I'm going to help him get some benefits. He's got over 40 pages, double-sided, of physical therapy notes and doctor's visits for his hamstring issue and his low back, and they have denied this man care, and it is sickening. So a lot of incompetence in the VA system, and the VA system is designed to deny benefits to our vets that really need the care and really need the help. So that's one thing that I do. It takes quite a bit of time. I do a pretty in-depth complete exam, and then I use the actual reference documents that the military uses to deny these vets' claims. I use those to proof the claim and say, hey, they've got these structural issues going on. You guys couldn't figure it out, but here was the cause, and he has these limitations, these physical limitations based on your own parameters, and that's how I get. In most cases, if they've been denied care and been denied some disability, they get their disability claims covered, and if they have been limited on their disability, they normally increase it. So something that I've been working on lately that is rather frustrating, and the same thing with workman's comp. One of the patients we worked on that was in the workman's comp system recently, and he had an upper cervical injury. He had, Charlie, what's called thoracic outlet syndrome. Now, thoracic outlet syndrome, you have nerve bundle C5 to T1 that comes out of the neck. It goes through what's called the brachial plexus. It goes through the shoulder and down to the hand. So he's working at his job. He was moving some beds around. He got injured, had to turn it in as a workman's comp claim. Workman's comp doctor just gave him some medication, zero improvement in symptoms. And when he came into our office, he was in dire pain. He had his arm resting on his head because that's thoracic outlet syndrome. That's one of the only ways that without chiropractic care that you can get some relief. So he couldn't even barely sit still for me to take a history on him. He was in that much pain. He had been to his medical doctor. She was smart enough to refer him to us. And in 3 visits, we got him fixed. We got him out of pain, got him back to work. And the workman's comp insurance company said, based on him seeing his medical doctor and getting an MRI, they didn't want to pay for that, and they didn't want to pay for our care. So they stuck him with a $2,000 bill and said, if you don't agree with it, well, take us to court. Well, who can afford to take
That's right.
an insurance company to court? So it's things like that.
And then that's your job, too. You don't want it to
Absolutely.
interfere with your job or
Right.
it affect your job.
Right. So
You take them to court.
very, things like that just aggravate the devil out of me. But we were able to get him fixed. But they really, insurance companies in a lot of instances take advantage of the patient. They take advantage of the client. They got all the power. They got all the money. But thoracic outlet syndrome, something that people normally would not associate with chiropractic care, we got him fixed. So shoulder issues, that's another one. We have patients come in all the time that have shoulder issues. They've been diagnosed with a shoulder problem. And a lot of those shoulder diagnoses, and some of them have already been to physical therapy and still have some symptoms. A lot of those so-called shoulder diagnoses are really what's called cervical radiculopathy. All the nerves that come out of the neck go through the shoulder and down to the hand. Normally, a shoulder injury should not radiate pain or numbness down your arm. Shoulder injury should be located locally right in the shoulder. So that's something that most people don't associate with chiropractic care, but a misalignment in the neck, if it's not cervical radiculopathy, will certainly weaken the shoulder. And we see this all the time. There are 4 muscles that basically support the shoulder, provide motion for the shoulder, provide stability for the shoulder, and the acronym for those 4 muscles is SITS, S-I-T-S. That is short for supraspinatus, infraspinatus, teres minor, subscapularis. Those are the 4 muscles that support the shoulder, and the shoulder is probably the most complicated joint in the whole body. Charlie, if you think about what's involved with raising your arm straight up over your head or straight up to the side, or reaching behind your back and scratching your back, or reaching across your body and grabbing the other shoulder, that shoulder has a tremendous range of motion. And if you think about all the strain that you put your shoulder through on a daily basis, those 4 shoulder muscles are about the size of your finger. Now think about all the strain that you put that shoulder through. Those 4 muscles the size of your finger, if they have 100% nerve innervation, then you're going to have good motion in that shoulder. You're going to have good structural strength and stability of that shoulder. But those 4 small muscles, if the neck is misaligned and it's affecting C5 to T1, if it is affecting that brachial plexus, then your shoulder will, in many cases, it will start to separate. Those shoulder muscles, instead of being able to hold at 100% strength, they may only be holding at 30 to 40% strength. So it allows that shoulder to start separating. But those 4 shoulder muscles get all of their nerve innervation from the mid part of the neck. So if the mid part of the neck is misaligned, that shoulder becomes weak, it starts to separate. So a lot of your shoulder injuries are definitely related to stability and alignment of the neck, how much chronic inflammation is in the neck, how much degeneration is in the neck. Very important. Once again, ties in with posture. I had a patient in this morning that came in to see us probably about 3 weeks ago. We talked briefly about her this morning. She came in with severe pain and numbness down her right arm. Now, most people that, and I talked with her about it this morning, I said most people that have not had a neck injury, have not had cervical radiculopathy, have not had a herniated disc, have not had severe sciatica, they just can't associate, they don't understand the level of pain that's involved with pressure on the spine, pressure on the nervous system. The body's going to protect that spinal cord. And when you have pressure, when you have inflammation on the spinal cord, the body's going to set up some severe pain. And it goes back to what is the most important organ in the body. And I ask patients, I used to do a health talk for our new patients. I ask patients, what do you think the most important organ in the body is? And some of them would say heart, and some of them would say lung, liver. It's the brain and the spinal cord. It's the only organ that God thought was important enough to protect with bone. The brainy skull is protected by, or the brain itself is protected by the bony skull. The spinal cord is protected by the bony vertebrae. So it's got to be pretty important if God designed protection for it with our bone structure. So when you have pressure on the nervous system, when you have direct pressure on the spine, the body's going to let you know it. That is key one for the body to tell you that, hey, we got a problem. So I was talking to her this morning, and she said when I came in here, my pain was so bad that if I could have taken a saw in my left hand and cut off my right arm and I thought it would help, I would have done it. I mean, that's how severe. And now she's, from the first or second visit, she came in with what she described as 11 out of 10 in pain instead of 10 out of 10, 11 out of 10. She left that first day. It was, I think we'd gotten it down to a 5 on the first day. Second visit, ever since then, it's been an average of about a 2. Well, the pain is gone. She still got a 2 or 3 on the numbness scale. So
she was telling me, not today, but the last time she was in, she said in the beginning, I kept thinking if the pain would just go away, I could deal with the numbness.
Mm-hmm. Yeah.
And now with the pain, she said,
and there is that. Gone.
Yeah, the pain is gone.
But we can get rid of the numbness. We can.
Well, that's what. So we're working on all that. We're working on your posture because she's got a little hump on the back of her neck, and we're working on all that. And,
absolutely.
She thinks I'm too old. At what age are you too old? Like, you're not.
No such thing.
You're not.
No such thing. So we are addressing the structural cause. We're correcting her posture. We're getting rid of the pain. We're getting rid of the numbness. What we're doing for her, and over the next month to 6 weeks, is going to help her the rest of her life. The rest of her life, once we get her fixed, she'll come in once a month and get a tune-up. Unless something really silly happens, she gets in a bad accident or she does something really silly, she will have quality of life the rest of her life. And that's my goal as a chiropractor. Is I like to help people when they're acute, but my real goal is quality of life in the retirement years, quality of life the rest of your life. And this all ties in with that posture. Carpal tunnel is another thing that people don't associate with chiropractic care, but I had a patient ask the other day, well, do you guys help with carpal tunnel? And Charlie, just to test your knowledge and see if we can stump you. Now, I used to have a hard time stumping Will.
Shouldn't be hard.
Yeah.
Go ahead.
What do you think the success rate is for carpal tunnel surgery? What would you think?
30%.
See, apple does not
I
fall
know.
far from the tree. 35%.
Okay.
Very good. Yeah, I see. I know where Will got his smarts from now.
His mother.
Yeah. But it's 35%. Now, just for the audience, carpal tunnel is pain, numbness, tingling in the hands. And it's the reason that the success rate for carpal tunnel surgery is 35% because 65% of the time, the cause is in the neck. And that goes back to that brachial plexus C5 to T1. But when the symptoms don't always show up where the problem is, the symptoms show up in the hands and the wrist. The cause is actually in the neck. The true people that truly have carpal tunnel are the people that have very physical jobs and they work with their hands. I'm not talking about sitting in front of a computer typing. I'm talking about running a jackhammer, swinging a hammer. Those people that have physical trauma involving the hand or wrist, those are the people that truly have carpal tunnel crush syndrome. But the people that sit in front of a desk or sit in front of a computer, diagnosed with carpal tunnel, get the carpal tunnel surgery, the symptoms return because the structural cause is still there, the loss of lateral curve of the neck. They're still sitting at their desk wrong. Their lifestyle, their habits are still feeding the pressure on those nerves, feeding that chronic inflammatory cycle. So what happens? The symptoms come back. So that's why success rate on carpal tunnel surgery is only 35%.
One of our patients in South Carolina, she had the surgery, and I mean, she was a school teacher.
Both
it's like
wrists.
how did
Absolutely.
how did she get that?
Right. Not from throwing books at the students.
No,
Can't do that.
Yeah.
no, I can't do that anymore.
I can remember when you could do that.
Oh, absolutely. Yeah, and there was a lot more. There was a lot less chaos in
There
the
really
school
was,
system. Yeah, when the teachers could dole out some punishment, and I was on the receiving end of a lot of that punishment at Broadwater.
as was I.
years ago.
But I had a teacher that one time, and she passed away recently, but she actually took her shoe off and started beating one of my friends over the head with a shoe because he
Oh,
did
my
something
gosh.
really dumb.
Oh my
Absolutely,
goodness.
So-
absolutely. Yes, I had.
And he's now has just retired as head of the had a big job in the Pentagon over the military fire apparatus at military bases
Right.
across the world.
Oh wow.
Wow.
So
Yeah.
apparently he did okay.
Absolutely. I had many instances where me and Mr. Bynum had at Broadwater.
A
Yeah.
disagreement.
Yeah, had a meeting with this paddle, and Mr. Bedell and I had a few, and I deserved every one of those licks that I got. Trust me. So, posture, vertigo. We will finish with one more tidbit that most people don't associate with the spine, loss of that lateral cervical curve, but I had a patient that we've been working on her sacroiliitis, and she was in again this morning. And for the past week and a half, she came in about a week ago and said, my SI joint, sacroiliac joint is doing much better, but I've had severe vertigo these past few days, and she's got some issues with posture, and I squeezed those two muscles on the front of her neck, and she about went through the ceiling, the scalene and sternocleidomastoid. And I explained to her how the attachment of those two muscles at the base of the skull affects cranial nerve 8. It's called a vestibulocochlear nerve. And your cerebellum, the part of the brain that helps you balance and gives you coordination, looks for three references, three signals. One comes from cranial nerve 2, the optic nerve, references the horizon. Second signal comes from proprioception, and that's the actual mechanoreceptors and proprioceptors in all the joints of the body. And the brain automatically monitors joint position sense through those position sensors, those mechanoreceptors. So the brain compares those two inputs. The third input comes from that vestibulocochlear nerve, the semicircular canals in your inner ear that sense motion. So if one of those three signals doesn't jive with the other two, the body gives you vertigo to sit you down as a protective mechanism. The brain is going to protect the body. So if you have one of those signals that's aberrant, it will sit you down. And we have patients come in all the time, even Meniere's disease, that have had issues with vertigo, and no one has checked condition of the neck. No one has checked those two muscles. So I showed her how to massage those out. We did a little posture work. She came in the next time. It's quite a bit better. She came in today, and she said it's almost gone. So some very simple things like that that people don't associate with going to the chiropractor. But I assure you, we are the specialist on spinal biomechanics of the spine. There's very few doctors that know more than your competent chiropractors as far as neurology goes, especially nowadays. Your old school neurologist, Dr. Pascal's pretty sharp, but he was trained years ago. Your neurologists nowadays are really lacking some of the basic neurology aspects. They've been so conditioned into prescribing gabapentin and Neurontin and doing nerve conduction velocity tests that they have overlooked some of the basic patient diagnostic skills that we were all taught as part of our med school beginning. So hopefully today some of our listeners got some ideas about some things that really associate with cervical posture, lateral sagittal cervical curve, and how chiropractic can help in some of these other realms.
All right, that sounds good. And just go over the information as to how to get in touch with you.
Our telephone, 331-1190. Email Bayside Chiropractic of cc@gmail.com.
Okay,
right.
Thank you. Ed and Janet Bull.
Great. Thank you, Charlie.
Thank you,
Bayside
Charlie.
Chiropractic, and I said it right, Rehab and Laser.
You got it.
Check us
Okay.
out on Facebook, Bayside Chiropractic.
Absolutely. And then you'll be here in a couple of weeks with some more good
2
stuff.
weeks.
Absolutely.
Thank you.
Thank you for listening to Shore Talk. This interview has been recorded and is available on WESR's YouTube page. To schedule a Shore Talk for your community event or organization, call us at 757-787-3200 or email Nancy at WESR.net.